In tonight's Healthy Living, it's one of the most popular over-the-counter pain relievers and fever reducers in America. And a new study suggests if you're a man taking it on a regular basis, you could become infertile. Male infertility is a problem that affects roughly 7% of American men. A study published this week in Proceedings of the National Academy of Sciences found regular ibuprofen use has a negative impact on the testicles of young men. Advil and Motrin are two brand names for ibuprofen. When taken in doses commonly used by athletes, a small sample of young men developed a hormonal condition called hypogonadism, which can lead to infertility, erectile dysfunction, depression, and a loss of bone and muscle mass. It's most commonly seen in smokers and the elderly, but the new research suggests it can affect young men too. For the study, researchers recruited 31 healthy men between 18 and 35. 14 of them took two 600 milligram doses of ibuprofen per day for 6 weeks, an amount consistent with what many athletes take to manage aches and pains, while the remaining took 17 placebo pills. Both groups of men submitted to blood tests and hormonal analysis throughout the study. After 14 days of ibuprofen use, the researchers observed higher blood levels of luteinizing hormone, which regulates the production of testosterone and other hormones. After 44 days, levels were even higher. Next, researchers tested the direct effect of ibuprofen on testicles using samples that had been taken from organ donors. When exposed to levels of ibuprofen similar to that which would be taken orally, the testicle samples produced less testosterone after just 24 hours. And here to talk about the study and its implications for men who take this popular over-the-counter medication is Dr. Mike Tungshin. Hi, Hsieh. Thank you for being here.
Thank you for having me.
You are affiliated with UC San Diego. You are a board-certified urologist, and you deal with infertility in your practice quite often. Were you surprised about the ibuprofen infertility link?
Yeah, I am surprised. I think this is such a common medication that we take every day, almost, for some men, maybe on a weekly basis. But before the viewers go home and throw away all their Advil bottles in fear for their manhood, there are some caveats to the study. And even though this is provocative, this is the first reports of ibuprofen on male testosterone level and fertility. So we still need more work to validate some of these studies, so to really understand the effect of ibuprofen in a man's body.
When it comes to taking ibuprofen, which is so common for pain relief and whatever, would you recommend your patients or men in general, young healthy men that are trying to conceive, to lay off it a little bit?
Yeah, that's a good question. In my everyday practice, this come up now that this study got so much press. Ibuprofen is an important medicine that we use routinely to avoid overprescription of the narcotic pain medicine. As you know, there's an opiate epidemic in our country. So, but we are understanding that there's a lot of environmental factors that can affect a man's fertility. So we do try to ask him to avoid certain things such as hot saunas and BPA in plastic bottles and potentially ibuprofen after reading this study.
Recent studies, a bunch of them, have concluded that fertility rates all around the globe have been plunging. What are some of the reasons?
Yeah, that's a good question. I think the study came out last year showed that over the last 40 years, a man's fertility has declined by as much as 52%. I think that's the study that you're referring to, Sandra. We now understand that there's probably a lot of environmental factors that could be our diet. We do have an obesity epidemic in our country as well. And then there are other environmental factors such as pesticides and chemicals that you and I probably ingest every day.
So this study, it said that there is a link, they believe, between infertility and ibuprofen. When the men stopped taking ibuprofen, did their sperm levels come back up?
That's a good question. Unfortunately, the study didn't really look at that specifically. We do think it should be a reversible effect. Every day, a man makes new sperm inside our body. So by stopping something that it would take about 2 to 3 months for us to observe the effect. So there is a chance that this can be recovered, just like other medications.
You deal with all kinds of men that have fertility issues. What percentage of men who have fertility issues are eventually able to, be successful with conception?
Yeah, that's a good question. Infertility affects about 20% of all couples, and about half the time it is a male problem. And unfortunately for most young men, we're a little embarrassed to go see the doctor, so a lot of times we delay in seeing the physicians to try to get help. But for a lot of time, there are many men, more than half the men that I see do have a correctable factor that we can help them with either medication, surgery, and sometimes in combination with with procedures like IVF to help them conceive.
UC San Diego is known to be on the cutting edge when it comes to research and studies. Are you doing research on medications that impact fertility or other things like that?
Yes, we have multiple ongoing research studies. One of them will be on the effect of opiates on a man's hormonal level. We know that by reversing a man's testosterone level, sometimes we can help them with their pain control and hopefully decrease their narcotic requirements. We also have ongoing study looking at stem cells and sperm maturation. Hopefully one day we can help cancer patients to regain their fertility.
All right. Well, thanks so much for sharing your thoughts. Appreciate your time, Dr. Hsieh from UC San Diego Health.
Thank you for having me.
All right.